All right.
Perfect. So, as a part of celebrating World Kidney Day today, I wanted to share with you some of what we worked on during this last year. One of the biggest struggles when COVID-19 became the pandemic we had to all live is to try and find ways to decide which patients are at highest risk of having poor outcomes and what should we do about it. And everybody was concerned about, oh, what about people with lung disease? What about people with cancer? And really nobody was talking about people with kidney disease, who are one of the highest groups that we as nephrologists and everybody out there, not only the kidney specialists, should worry about, because they're usually at higher risk of bad outcomes in general. So what we did is we actually decided to go ahead and look through the literature. Instead of using patients as our participants, we used the published literature as our participating data set. And we did what we call an umbrella review. An umbrella review is we put all these different reviews together and we looked at what happens very carefully. We kind of investigated these studies for people with kidney disease, and when they have COVID, what happened to them. And one thing that was very striking is no matter what kind of study you looked at, if it was big, large, based on a specific hospital, multiple hospitals, the data was very, very consistent. It showed us that people with kidney disease were at higher risk of hospitalization. Actually, they were 5.8 times higher risk of hospitalization than everybody else. When we looked at ICU admission, they were also at higher risk of ICU admissions. So they were more than 1.5 times higher risk of getting to a hospital compared to those who don't have kidney disease. They were also at higher risk of having a severe disease, a disease that required some of those really questionable or medications that were under investigation at that point. But guess what? A lot of the studies excluded people with kidney disease from their inclusion criteria. So that put us in a bind to not know what to do with them. And last thing, they were considerably 2.5 times more likely to die from COVID if they had kidney disease. So all this made us really question, okay, given that we know that people with kidney disease are at higher risk of all bad outcomes, why were they not part of the early considerations that we need to get those people vaccinations early? They were not part of the early vaccination list. And this data actually helped change policy where they put these patients at a higher risk at the international level. So the World Health Organization, for example, looked at this and said, oh, this is a high-risk group, we need to prioritize it for vaccination. So this is what we did. So this is really putting our knowledge into how to change policy at the bigger picture. Thank you.